The call for increased funding in Nigeria's health sector has taken center stage at the House of Representatives Committee on Healthcare Services Budget Defense in Abuja. Health agencies, including the National Primary Healthcare Development Agency and the NCDC and others, presented their 2025 proposals highlighting the need for urgent financial intervention to improve healthcare delivery. With a push for a healthier Nigeria as key health agencies appeared before the House Committee on Healthcare Services to defend their budget proposals. The National Primary Healthcare Development Agency has requested 48.147 billion naira for the coming year. Executive Director Dr. Muyi Aino says despite alternative funding sources like the Basic Healthcare Provision Fund, the agency needs more support.
So one of the major challenges was that the vaccine targets girls aged 9 to 14 years. If you look at our health system, generally speaking, that population, we have almost nothing else that routinely engages them. It's usually very young children that we give routine vaccines before we introduce HPV, or older people, pregnant women, or elderly people that have chronic illnesses. This age is not the age that we had a lot of experience engaging at scale. But what we then did was to take a multi-sectoral approach so that beyond the health sector, engaging with education, engaging more deliberate with the communities.
The Nigeria Center for Disease Control and Prevention, NCDC, also tabled its needs with 7.38 billion naira proposed. The NCDC's Director General Dr. Jide Idris explained the funds would bolster the country's preparedness against outbreak.
Track data, we track events. When we see anything unusually high, it's a trigger. We send people to go and investigate. And more importantly again, in our detection capabilities, we're not even relying on the old models again. We're going to genomic sequencing, which is faster, modern, and can detect many diseases, not only one. So to answer your question, yes, we are relatively ready. I cannot tell you that we're 100% ready because we don't know what is coming. We don't know the nature.
Meanwhile, the Medical and Dental Council of Nigeria, excluded from the 2024 budget, is asking for 113 billion naira for its 2025 operations. Registrar Dr. Fatima Kyari stressed the need for sustainable funding beyond registration fees. For the National Health Insurance Authority, coverage expansion is a priority. Director General Dr. Kelechi Ohiri says 130 billion naira will help increase enrollment, but plans to collaborate with telecom companies and embrace digital tools. The chairman of the committee, Honorable Amos Magaji, echoed the importance of a functional healthcare system.
If we don't deliberately build our healthcare system, we're in for a big trouble, because some of these health emergency, when they come, even if you have a private jet and then the airports are closed, you can't go anywhere. So it behoves on us all here to make sure that our health care system is really functional.
With the committee members pledging to review funding envelopes, the hope is for a 2025 budget that will prioritize health and well-being across the country. Anieti Patrick, Core TV News, Abuja.